I went to a rural clinic in Rwanda, really middle of nowhere, at the end of a road to nowhere, and a beautiful facility, actually. But as I usually do, I asked the head of the hospital, I'd like to see the opportunistic infections that relate to AIDS, or I'd like to see the malaria cases, cerebral malaria, or the hard cases of malaria that they have. And the head of the hospital said, we don't have any of those. And I asked again, this was through a translator, to see this. And he said, no, we are now dealing with low birth weight babies, diabetes, heart disease in this facility. There's 94% coverage in our area with AIDS drugs. Malaria has essentially been defeated in that part of the country. And it was one of the most moving things I've ever seen in Africa, were empty hospital beds. I mean, this is a return to normality. And that doesn't mean they don't have challenges, but it means that they don't have to live with this hanging over their head.
And what's interesting about that is that it chimes with work that we've done at the centre here, a book coming out called Million Saved, which is a catalogue, if you like, that documents successful health interventions and gives the lie to people who say aid is wasted, it's a waste of money. And it's important to kind of make that point that this stuff works, it can work, but we've got to do it efficiently.
Yeah, I think Michael's description of the success of the fight on HIV/AIDS has become a model for a lot of other efforts. So when we launched Feed the Future, we looked at what were the components of doing it efficiently. Country-led plans, public-private partnerships, baseline surveys followed up by follow-on surveys to actually understand the effects. And that's why we can say when the Feed the Future has moved 12 million children out of a persistent hunger and poverty into an opportunity where they're not suffering that way.
And how important was it for you to make sure that some of that Feed the Future budget was spent on evaluation?
Well, it was critical. In fact, that's otherwise you don't know. And you can't say with some degree of confidence and certainty that this is the impact.